take you inside the nursing home, what goes on, tell you a little about what can take place with your family member, the hidden secrets that can cause infections, ways to look out for your family member, ways to check up on them, ways to make sure that they're getting the proper medication that they deserve and not being abused. This first photo is the inside of a nursing home taken on a Sunday at 6 p.m. at night. The halls are empty because at this particular nursing home and at a few others I have experienced, the patients are made to go to bed right after dinner. The reason for this is the average staff does not want to have to work their entire shift. They feel if the patient is in bed early, they can spend the rest of their shift sitting around watching TV, chatting with others. Now, if your loved one is one of those who do not like to go to bed early and continue to call out or continue to press their call button, the aide just might ask the nurse on duty to administer that patient their sleep medication or some other form to help them relax. Items such as Benadryl or melatonin is commonly used as over-the-counter medication. The nurse might also give them Ativan or Xanax if prescribed. These are usually meant for anxiety, but they are used for sleep aids also. However, you, the family member, can keep an eye on them and find out what is being given to them, because all narcotics are to be documented and signed when they're taken. You can ask to see how often their medication is being given to them. If the medication is on an as-needed basis, you should not be seeing it given every single night. The way to go about this is just go up to the nurse and ask to see the narcotic book. Pull up the page with the narcotic description on it, and it will show you dates and times that it was given. In this next photo, you see bruising, which is located on the arm near the armpit. It's a common place because instead of staff using a gait belt to assist the patient when it comes to standing or transferring, they often grab the patient under the arms and pull up, causing unnecessary bruising. Now, this picture here, we walked into this room. The room had supposedly just been thoroughly cleaned and readied for new patients. And right there underneath the clothes dresser, there's a white object. We bent down, we picked up the white object, and when we removed it, we found out it was a plastic urinal that had dried blood and dried urine in it. Who knows how long it had been left there, but I can tell you that urine and blood take quite a while to dry and to become as thick as this was. This is another shot of that urinal after we pulled it out. Once again, inside you can see the dried blood and urine. This is the urinal turned on its side. Rooms are cleaned on a weekly basis. Unfortunately, the house cleaners that go in there usually do not get down and look underneath dressers or beds. They only really care about what their eyes can see when they walk in the room. Therefore, they really only look down at their mop or broom. They need to get a little bit better to see what may be lying hidden around. I don't think you want your family member moving into a room with this being left in there. I want to talk about food also that is being served in nursing homes. If you go there to visit your family member during mealtime, take the time to check the temperature. Also, check the food texture. Is it proper temperature to eat? Is the food too hard to eat? Too often the food is overcooked or not cooked properly. The reason for this is most cooks in a nursing home, the average cook is not somebody that has been properly trained in some school. It's somebody in the neighborhood that comes there. However, they are not trained to cook for 90 plus people. They usually cook for 5 people or less, their family members, not 90 or more people. What you're looking at here is not a meal. However, this is one of the snacks that is given out on a nightly basis. Looks like a good sandwich from here. Unfortunately, when you unwrap it, all you have is 2 slices of bread, 1 slice of meat, 1 slice of cheese. There is no mayonnaise, no mustard, no lettuce, no tomato, no nothing. How appetizing is that? Now then, when you do go to see your family member, one good way to see if your family member is being taken care of properly or being changed in a timely manner, take a marker with you. Place an X on the patient's diaper and see how long that diaper stays on, especially if the person is incontinent. Look at the position that they're lying in if they're in bed. Soiled diapers and laying on the same side is one of the most main reasons for skin breakdown. Check yourself to see if their skin is breaking down, especially on the buttocks, which is a common area for this to happen. If they do have breakdown, is there dressing on the wound? Is the dressing dry? Is it properly dated? These are just signs you need to check for. Also, when you go there, don't always go at the same time. Go at different times. Go often. Talk to other patients when you get there. It's very well known that patients do keep an eye out for each other. When you're there, look at your family members' teeth. Are they being brushed enough? Are they getting good oral care like they're supposed to be? A lot goes on inside nursing homes. I'm not saying for you to keep your family member home, but if you are going to place them in a nursing home, please stay on top of things. Please interact, get to know their medications, keep an eye out on the food they're eating, keep an eye on their daily care. This is the only way to assure a proper, healthy life for them. Unfortunately, facilities are usually understaffed and underpaid. The sad part is the staff members are unhappy and they come to work angry, they don't want to be there, and it ends up falling out on the resident. This is your family member's home. This is their last journey. Don't you want to make it as pleasurable as it should be? What if you were there? What if you were lying in one of these beds? How would you want to be treated? Most of all, know your family's rights. You have rights, they have rights, and they need to be followed. Anyways, I hope this video was informative. If you liked the video, please pass it on, click subscribe, and keep an eye out in the near future because I will be making more videos. There is so much more to talk about when it comes to a nursing home.